let's focus our attention on this story now, which is interesting because we don't often talk about our healthcare professionals. The World Health Organization's Regional Office for Africa has taken a major step, I think, to improve the quality of health training across the continent. Meeting in Kintele, in the Republic of Congo, experts have validated new competency-based curricula for 10 key health professions. Now, the initiative aims to close skills gaps and ensure that Africa's health workers are better equipped to meet the needs of their communities. And to tell us a little bit more about this milestone, we're now joined on the line and by Dr. James Avoka Asamani, who's the Health Workforce Team Lead at the WHO's Regional Office for Africa. Thanks very much indeed for joining us and welcome to the program. Perhaps we can start by looking at what were the skills gaps or the challenges in training that you saw that needed to be addressed. Hello, Dr. Asami, can you hear me? Dr. Avoka Asami? All right, we're struggling with the connection there. Oh, I think we can hear him now. All right, thanks so much indeed for joining us. I don't know if you heard the first question, and it really was about there must have been a gap that you saw in. Uh, there was a gap in terms of the training or the skills across the continent that you must have seen for you to come up with this initiative. Describe some of the issues that you were seeing.
Good morning, and thank you for having me. So at WHO, we have been monitoring the situation of health workforce in Africa. And over the last decade, we have seen some progress that is commendable in terms of expanding the opportunities to train health workers and the actual number of health workers trained. The numbers have moved from less than 2 million to currently 5.1 million health workers across Africa. But there are also challenges. The challenges that remain are that there are inadequacies of health workers across the continent, but also importantly, there are competency gaps in the health workers that have already been trained. And addressing these competency gaps at the service delivery point requires more in-service training to fill the gaps that could have been easily addressed at the point of their initial education. So it is this kind of challenge that has informed WHO to take a step back and look at what health workers are trained on and try to come up with competencies that would align with the population health needs, but also help in harmonizing curricula across the continent.
Tell us a little bit more about the health professions that you chose. What is it about these professions that you decided this is where we need to start?
Yeah, so we recognize that there are several health professions in the health sector. In fact, in some countries, we have well over 100 different cadres of health workers. But to start with, we were looking at the health workers who represent the largest majority of the professionals in the health sector and tend to have a much direct contact with the population. So when we start addressing that, we are addressing the big part of the challenge before we come to the rest that resources don't allow us to tackle immediately. So that is why we started with generalists and specialists, professionals among doctors and nurses and midwives to start with. But that doesn't mean they're the only ones that we are focusing on.
So tell us a little bit more about what distinguishes these competency-based curricula from traditional training curricula. What changes in approach or emphasis are you hoping that they'll bring?
So the concept of competency-based curricula is to say that we first look at the population in the countries, in this case, across the African countries. What are their common health challenges? What kind of capacity do you want a health worker to have to address those specific challenges rather than focusing on what topics should we teach? So we focus on what should they be able to do, and we focus the curricula to address what they'll be able to do. So what is really new and different is that this curriculum actually aligns directly with the current challenges of the population in Africa. But beyond that, it focuses on outcomes, what the worker would be able to do upon graduation. And these outcomes are defined, and already WHO has defined more broadly outcomes that are necessary to achieve universal health coverage, and this curriculum aligns with that, therefore ensuring global alignment, but with regional kind of specificity. In addition to that, we are going beyond just having a curriculum as a document, but focusing on the fidelity of training institutions to that curriculum when they are implementing it, focusing on the building capacity of the trainers themselves, as well as the infrastructure and technology that is required to deliver the curriculum in a way that will be student-centric.
I guess one of the things that you're going to have to work hard to do, because various countries are at different levels of competency, helping the different countries to adapt to this new way of doing things. How are you going to do that?
So we discussing with countries and different stakeholders, the regulators of health professions. So the medical councils, the nursing councils, the pharmacy councils, the allied health councils, and the professional associations, as well as the academic institutions themselves and governments. Now, with the engagement, what has emerged is that it's more recommended that after the curriculum is completed, we get each country bring together their regulators, academic, and then the government, the ministries of health, to draw their national roadmap and adapt this curriculum to their national context. And what is adapted to their national context will be known as the national reference curriculum. And each institution would have to ensure some degree of alignment. There's still discussions as to what proportion of alignment would be most appropriate, but each institution in the country will have a degree of alignment with the national reference curriculum, which also has an alignment with the continental curriculum that we are developing. So with this, then there will be the health professions education quality standards, which is used for benchmarking. So at a national level, the regulators will use that to benchmark the institutions, but also at the continental level, when we want to foster mutual recognition of qualifications between countries, we can benchmark each country to be sure that their curriculum and their standard of training is comparable.
And that's where we're going to have to leave it. But we wish you the best of luck with this, because clearly improved training has an impact on us, ordinary Africans, getting better healthcare. Thank you so much indeed for your time.
Absolutely. Thank you so much for having me this morning.
That's Dr. James Avoka Asamani, Health Workforce Team Lead at the World Health Organization's Regional Office for Africa, talking to us about new training methods for our healthcare providers.